to light the way, making nursing stupid simple every day.
Stop. Before you memorize a single number, watch this first. Vital signs are the most important thing you will check on every single patient, every shift, every time. And if you get them wrong, you could miss something serious. But here's the good news. After this video, vital signs will never confuse you again. Let's make this stupid simple.
What even are vital signs? Think of them as your patient's body report card. They tell you how the body is working right now. For nursing, we usually track temperature, pulse, respirations, blood pressure, oxygen saturation, and pain. Together, they help you decide stable, changing, or headed for trouble. Here's the clinical thinking part. Vital signs are an early warning system. A fever may point to infection. A fast pulse may mean pain, anxiety, blood loss, dehydration, fever, or shock. Low oxygen saturation may show the patient is not oxygenating well before they can explain what is wrong. Nurses who catch trends early can prevent crises. First, temperature. Average adult temperature is about 98.6 degrees Fahrenheit or 37 Celsius, but normal can vary slightly. Fever is commonly 100.4 Fahrenheit or 38 Celsius and up. Hypothermia is abnormally low body temperature, often below 95 Fahrenheit or 35 Celsius. Temperature sites include oral, rectal, axillary, and tympanic. Axillary is easy but less accurate. Rectal is often more accurate but used only when appropriate. Nursing priority. Don't just chart a fever and move on. Look for the source, reassess, and report according to policy. Next, pulse. Normal adult resting pulse is 60 to 100 beats per minute. Above 100 is tachycardia. Below 60 is bradycardia. Assess rate, rhythm, and strength. Is it regular, irregular, strong, weak, thready? The radial pulse at the wrist is common, but an apical pulse is taken at the heart with a stethoscope. If the pulse is irregular, count the apical pulse for a full 60 seconds. NCLEX Classic. Digoxin can slow the heart. If the adult apical pulse is below 60, hold the medication and notify the provider, unless your facility policy says otherwise. Third, respirations. Normal adult respirations are about 12 to 20 breaths per minute. Count without telling the patient if you can, because people change their breathing when they know you're watching. Look at rate, depth, effort, and pattern. Fourth, blood pressure. Blood pressure reflects force against vessel walls. Think perfusion. Too low can mean poor circulation. Too high increases long-term risk. Always notice trends, symptoms, and baseline. Fifth, oxygen saturation, or SpO2. This estimates how much oxygen is carried in the blood. Many adults are expected to be around 95 to 100%, but some patients have different ordered goals. Last, pain. Pain is subjective. Ask, assess, intervene, reassess. Vital signs are not just numbers, they are clues. Learn normal, spot abnormal, and always ask, what changed, why, and what do I do next?
Okay, memory tricks. Write these down right now. Temperature, hot equals fever. Cold equals hypothermia. Simple as that. Pulse, tachy means too fast. Think race car revving. Brady means too slow. Think grandma on a Sunday drive. No offense, grandma. Respirations. Count secretly. Your patient does not know you are counting. Keep your fingers on the wrist so they think you are still checking the pulse. You will get the real number every time. Blood pressure. Systolic equals squeeze. The heart squeezing down. Diastolic equals diamond. The heart resting, relaxed, like wearing a diamond ring loosely on your finger. SpO2. Think of it as the body's oxygen fuel tank. Normal is 95 to 100. COPD patients run lower, 88 to 92. Over-oxygenating a COPD patient is dangerous. Pain. Whatever the patient says it is. Use OPQRST to dig deeper. Oh, please quickly rate something today. And always, always reassess after you treat. Pulse ox. Great tool. But nail polish, cold hands, carbon monoxide poisoning, and anemia can all fool it. Assess the patient, not just the clip. NCLEX. These come up on exams repeatedly. Lock them in. Number 1, fever is 100.4 degrees Fahrenheit or higher. Not 99, not 100. 100.4 is the line. Know it cold. Number 2, rectal temperature is the most accurate. Axillary, the armpit, is the least accurate. Oral and tympanic fall in the middle. Number 3, if a pulse is irregular, you take an apical pulse for a full 60 seconds. Not 30 and double, not 15 and multiply. Full minute. Number 4, hold digoxin if the apical pulse is below 60. Notify the provider immediately. Classic medication safety question. Number 5, hypertensive crisis is 180/120 or higher. That is a medical emergency. You call right now. Number 6, COPD target SpO2 is 88 to 92%. Do not run high-flow oxygen on a COPD patient without an order. The hypoxic drive is real and it is tested. Number 7, carbon monoxide poisoning gives a falsely normal pulse ox reading. The machine cannot tell the difference between oxygen and CO bound to hemoglobin. Number 8, reassess pain 30 to 60 minutes after oral medication. Sooner for IV. Document the reassessment every single time. Number 9, a cuff that is too small gives a falsely high blood pressure reading. Too large gives falsely low. Cuff size matters. Number 10, changes from baseline are just as important as the actual numbers. A blood pressure of 100/60 might be normal for one patient and shock for another. Okay, pop quiz time. This is where you find out if it actually stuck. Pause after each question if you need to think. No peeking. Ready? Question 1. A patient's temperature is 100.6 degrees Fahrenheit. What is this called and what do you do? Question 2. You assess a patient's pulse and it is 54 beats per minute and feels irregular. What is your next action? Question 3. Your patient with COPD has an SpO2 of 91%. Is this a problem? Question 4. A patient tells you their pain is a 9 out of 10. You look at them and they seem calm and comfortable. What do you do? Question 5. You are about to take blood pressure and notice the patient has an IV running in their right arm. What do you do? Question 6. A patient with suspected carbon monoxide poisoning has a pulse ox reading of 99%. Is that reassuring? Pause the video right now. Think through each one. I'll give you the answers in just a second. No cheating. Okay, answers. Let's see how you did. Question 1. 100.6 degrees is a fever. Anything at 100.4 or above is a fever. You document it exactly as it reads, report it to the provider, and start looking for a source. Question 2. A pulse of 54 that feels irregular. You take an apical pulse for a full 60 seconds. You do not shortcut. Then you document the rate and rhythm and report it. If the patient is on digoxin, you hold the next dose and call. Question 3. SpO2 of 91% in a COPD patient. This is actually within the acceptable target range of 88 to 92% for COPD. You still assess the patient for any signs of distress, but 91 alone is not an emergency for a diagnosed COPD patient. Question 4. Pain of 9 out of 10. You believe them, period. Pain is subjective. Their experience is real regardless of how they appear on the outside. You address it, medicate if ordered, and reassess within the appropriate time frame. Question 5. IV in the right arm. You use the left arm. If neither arm is available, you can use the thigh with a properly sized cuff. You never compress an IV line with a blood pressure cuff. Question 6. Carbon monoxide poisoning with a pulse ox of 99%. No, that is not reassuring. The pulse oximeter cannot distinguish between hemoglobin carrying oxygen and hemoglobin carrying CO. That 99% is a false reading. The patient may be in serious danger. This is a clinical assessment situation, not a monitor situation. How did you do? Drop your score in the comments. I love seeing how you're growing. And that is vital signs. Stupid simple. Temperature, pulse, respirations, blood pressure, SpO2, pain. You now know all of them, the normal ranges, the danger signs, the memory tricks, and how real nurses think about them. Know your normals, catch the changes, report what matters. That is the job. You have got this. If this video helped you today, hit that like button. It takes 1 second and it helps more nursing students find this channel. That means everything. Subscribe to No BS Nursing so you never miss a lesson. And hit that notification bell so you are first to know when the next one drops. The free cheat sheet for this entire video is linked in the description below. Print it, study it, put it on your wall, take it to clinical. See you in the next one.